We can start now. So today our session will be surgery coding live chat. Okay. So most of the time people know about the guidelines. Why means all of you have completed CPC certification. In CPC certification, most of the time we will use the guidelines and we will practice. But in live coding it is different. Here also guidelines will be useful, but how to use those guidelines practically we need to use in the live chat. Okay. So today our topic surgery coding live chat training using AI. So in our training we will use AI also. Okay. So I will explain to you how to use AI while coding live chats or in the live coding. Okay. My name is Harish Gupta. So I am a freelance trainer as well as content creator for FastCoder 21 YouTube channel. So I have two YouTube channels, FastCoder 21 English and SuperCoder 21 Telugu Medical Coding YouTube channel. Next, today we will practice one chart first, then you will know what you are going to learn during this training. Okay. So this is the appendix. So today we are going to learn about appendectomy. Okay. So whenever you code any chart, you need to know the anatomy of that anatomical area. So as I told you now, we are going to learn about appendectomy. So we need to know about appendix first. So why means these same words will appear in the operative report also. So that is the reason. First of all, we need to understand the anatomy. Okay. So the appendix is the vestigial organ. So basically there is no function with this appendix, vestigial organ. So basically here the parts of appendix, base of the appendix, which is connected to large intestine. So this is the cecum. Okay. So this is the base of the cecum is appendix. So this is the base of appendix. This is the appendiceal artery. So using this artery, appendix will get the blood supply. This is the mesoappendix. Okay. So basically this mesoappendix is the triangular layer which will connect the peritoneum with the appendix. Okay. And this is the appendix. So try to remember these words. Why means if you see the live chat, you will find all these words. Okay. So here we will go to, so here our preoperative diagnosis is acute appendicitis. So what is appendicitis, guys? What is appendicitis? Anyone knows? What is appendicitis?
Inflammation of appendix.
Yeah, perfect. So inflammation of appendix. Okay. So patient has acute appendicitis. So patient is going to perform laparoscopic appendectomy. Okay. So these are the intraoperative findings. Means intraoperative during the surgery. Patient has identified include inflamed non-perforated appendix. Okay. So patient has identified the inflamed appendix here. Okay. So here our post-op diagnosis is acute appendicitis. So post-op means after performing the procedure, patient has confirmed that patient has appendicitis. So I have performed laparoscopic appendectomy. Okay. So whenever you code any chart, you need to check the medical necessity. Okay. So here our medical necessity is excellent. So patient has appendicitis, patient has performed appendectomy. Okay. So now we will see the chart. So this is the operative note. So the patient was seen by me in the preoperative holding area. So before coming to the OR, patient has identified or seen the patient in the preoperative, means before the operation. Okay. So the risk of the procedure were explained. As it is mandatory to the physician to explain all the risk related to the procedure to the patient. Even if you go hospital also, doctor will tell us. So you are going to have this procedure tomorrow. So if you undergo this procedure, you are going to have these risks. Okay. So she was taken to the operating room and given peri-operative antibiotics prior to coming to the surgery. Okay. So after like explaining the risk of the procedure, patient took patient into the operating room. Okay. Operating room, and patient had get perioperative antibiotics. Okay. So general anesthesia was carried out without difficulty and a Foley catheter was inserted. Okay. So initially patient has provided antibiotics. Afterwards patient has provided general anesthesia. Okay. And also Foley catheter was inserted. Next, the left arm was trucked and the abdomen was prepped with betadine and wrapped in sterile fashion. So as patient is planning to perform procedure on the abdominal area. Why means appendix is located in the abdomen, correct? Inside the abdomen. So in order to start the procedure, patient needs to clean the abdomen. So here prepped means cleaning the abdomen with betadine and wrapped in sterile fashion. So a 5 mm blunt port was inserted infraumbilically at the level of the umbilicals under direct vision of 5 mm O degree laparoscope. Okay. So these are the key things here you need to understand. Okay. In surgery, we have multiple approaches like open procedure, percutaneous procedure, as well as laparoscopic procedure, endoscopic procedure, as well as robotic procedures. Okay. So here our procedure is laparoscopic. Why means Pishni has mentioned here, she provided the port here. So this is the keyword for laparoscopic procedure. Okay. Once we are inside the abdominal cavity, CO2 was inflated or instilled to attain an adequate pneumoperitoneum. Okay. So CO2 gas. So whenever you see CO2 gas in the operative report, you need to understand patient is performing laparoscopic procedure. Okay. So this is not open procedure. A left quadrant 5 mm port was placed under direct vision and a 12 mm port in the suprapubic region. Suprapubic means above the pubic area. So in order to perform laparoscopy, patient needs to use 2 to 3 ports or opening. So here patient is telling basically how many ports he is performing for this procedure. Okay. So here patient has provided the ports. The 5 mm scope was introduced at the umbilical port and the appendix was easily visualized. So in these 3 lines, patient has like created the ports. Through that port, Pishni has introduced the scope. Okay. So using that scope, Pishni has identified the appendix. So the base of the cecum was acutely inflamed but not perforated. So we have seen, correct? So this is the cecum. Base of the cecum, this area. Okay. That one. Okay. So next, I then was easily able to grasp the mesoappendix and create a window between the base of the mesoappendix and the base of the appendix. Okay. So in order to release this appendix, Pishni has released this mesoappendix. Okay. So basically mesoappendix is the fibrous tissue. So in order to release this appendix, Pishni has released the mesoappendix. Okay. So I reloaded with a red vascular cartilage or cartridge, came across the mesoappendix without difficulty. I then placed the appendix in an endo bag and brought out through the suprapubic port without difficulty. Okay. So here Pishni has used the endo GAA blue cartridge. Okay. And he removed the appendix. Okay. So he removed the appendix through the port, suprapubic port. I reinserted the suprapubic port and irrigated out of the right lower quadrant until dry. So here basically what is important here, after releasing the mesoappendix, physician has removed the appendix through the supraumbilical port or suprapubic port. Okay. So this is the thing. So we then removed all ports under direct vision and there was no bleeding from the abdominal trocar sites. Okay. So here physician has telling that. So I have removed the appendix through the endobag using the suprapubic port. There are no problem after removing the appendix. Afterwards, I have removed all the ports under direct vision. Okay. And there was no bleeding from the abdominal trocar site. The pneumoperitoneum was then deflated and the suprapubic facial defect was closed with ovicral suture. Okay. Again, patient has skin incision is injected with 0.25% marcaine and closed with 4 monocryle sutures. Again, patient has performed the steri-strips. Okay. Here, the specimen is the appendix brought to the recovery room in stable condition. Okay. So this is the operative report. Okay. So in live coding, you will get this operative report like this only. Okay. So now tell me, what is our diagnosis?
Appendicitis.
Appendicitis. Perfect.
Appendicitis.
Yeah. What is the type of procedure? It's one open, percutaneous, or laparoscopic?
Laparoscopic.
Yeah. What are the keywords for laparoscopic procedure? How did you identify?
Port.
Yeah, go ahead.
Port mentioned.
Yeah.
Port.
Yeah. Correct. Then how did you identify patient has removed the appendix? Which part of the operative report you will identify that patient has removed the appendix? So this one. I then placed the appendix in the endo bag. Means patient has removed the appendix. He excised the appendix and kept in the endo bag. Okay. And he removed the all ports. So basically, patient has appendicitis. Patient has performed laparoscopic appendectomy. Okay. Now we need to code this procedure. Correct? So in order to code this procedure, we need to use one approach. First, we need to find the heading. So what is the heading of this procedure? Or what is the operative report? What is the heading here?
Appendectomy.
Perfect. Laparoscopic appendectomy. Correct? So directly this is the CPT book index. Okay. So we'll go to appendectomy. Okay. So here how many approaches are there in appendectomy? See this one. How many approaches are there? Anyone?
Appendix excision laparoscopic.
Yeah, perfect. So total how many approaches? 2 approaches.
2 of them.
Yeah, always excision comes under open approach, not laparoscopy. Okay. Appendix excision and laparoscopic procedure. Okay. So these are the codes for excision. These are the codes for laparoscopy. Laparoscopic approach. Okay. So then we have already read the operative report. Okay. Now we need to go to the CPT code book. So what is the code here? 44950. Okay. So here is the 44950. So these all codes are related to appendectomy basically. So 44950. So this is for appendectomy. This is only open procedure. Why means as I told you just now, all the excision procedure comes under open procedure. Okay. So 44950 appendectomy, add-on code 44955. When done for indicative at the time other major procedure. Okay. So 44960 for ruptured appendix with abscess or generalized peritonitis. Okay. So is our appendix is ruptured or not? What did you see in the operative report? Is it ruptured or not?
Not ruptured.
Yeah, perfect. Okay. So not ruptured. Correct. Next, these are the open procedure, excision basically. These are the laparoscopy procedures. So in laparoscopy surgical appendectomy 44970. Okay. So if you're unable to find any code in the appendix area using the laparoscopic approach, you need to use 44979. Okay. So now fourth step, you need to identify general guidelines related to this one. So general guidelines means basically under the code. Okay. So laparoscopy, surgical appendectomy. So below the code, we don't have any guidelines. Directly we can quote 44970. Okay. Next, you need to check, you need to add any extra codes along with this procedure. So that is also same. So here we don't have any specific guidelines related to 44970. Okay. Lastly, you need to check the modifier. So whether you need to append modifier to appendectomy code or not. Okay. So as appendix is the single organ, so we don't have any modifier. So we no need to use any modifier for appendectomy 44970. Okay. So like that, we have confirmed that for this procedure, for this laparoscopic appendectomy, our final code is 44970. Okay. So why 44970 guys? Why not 44950? Anyone?
This laparoscopic appendectomy.
Yeah.
That's why we can use 44970.
Yeah. Perfect. Okay. So as it is a laparoscopic approach based on our operative report, we need to use laparoscopic code, not open procedure code. Okay. So in order to understand this one, you need to know how to check open procedure, laparoscopic procedure, and percutaneous procedure. Those you will learn in the live coding. So any doubts guys here? Clear? Are you able to understand? How did we
Can you?
choose correct
Yes,
code?
yes, David.
Yeah, thank you.
Can you repeat once?
What do you want me to repeat?
About that, how to select the laparoscopy procedure, laparoscopy in this chart.
So I will post this video in the YouTube. You no need to worry. You can watch again.
Yeah, okay.
Okay. Yeah. Next, what you learn during this live chat training. Okay. So why means nowadays, if you observe in interviews, they are not asking any guidelines. They are asking very few guidelines and they are asking how do you select the keywords in the operative report. Okay. So this I got from my old students. So those people already undergone the training. So they are calling me and they are telling. So your training is very useful, sir. So in the interviews, they are asking only live chats. So they are providing one live chat and they are asking. So how do you choose the keywords in live chat? Okay. So like that. So first you will learn types of surgeries. So most of the coders are having the confusion. What is same day surgery? What is ambulatory surgery? And what is general surgery? Okay. We will learn all those types of surgeries during our live coding. Next, we will use or we will learn modifiers. As a surgery coder, you need to master nearly 10 modifiers only. Not all modifiers are needed for us. Only 10 to 15 modifiers are useful. That we will learn. Okay. Next, NCC edits. Okay. So we have three types of edits. PTP edits, add-on code edits, and MUG edits. Okay. So we will learn all those edits. If you understand those edits, we can code any live chat in an easy way and you will not be confused if you find 3 or 4 codes during the live chat coding. Okay. Next, we will learn the positions of the patient during the surgery. Why means few procedures we need to understand based on the patient's position. Okay. So those key points I will teach you. Next, approaches. As already we have discussed. So total how many approaches guys? Tell me few approaches.
Laparoscopic,
Yes.
subcutaneous,
Percutaneous.
Arthroscopic.
Yeah. Arthroscopic.
then
Open laparoscopic percutaneous.
Percutaneous open approach.
Yes. Yeah. Endoscopic approach. These all are approaches only. Okay. So those we will learn completely during live coding. Okay. And one more important thing is whenever we start any session, okay, first we learn the common procedures related to that chapter. For example, we are going to start digest system charts. So first we will learn all these things. What is appendectomy? What is colectomy? What is colonoscopy? What is colostomy, ileostomy, polypectomy, small bowel transplant? So this is only example for digestive system. For example, if you are planning to code integumentary, first we will learn all common procedure from integumentary system. Then we will start live charts. Okay. Next, here in this live chart training, you will learn 1 to 6 series, approximately 40 to 50 live charts. Okay. And you will learn components of operative report. Okay.
Sorry for interrupting.
Yeah.
Is this only like STS or general procedures also you will teach?
So all procedures.
All.
All
Okay,
procedures.
okay.
Okay. So all procedures means whole charts are 40 to 50 charts. Those charts contain all general surgery, everything is included. Okay.
Means 42 charges in every series or complete 42 charges?
Like integumentary 8 charts.
Okay.
Musculo 8 charts like that. Whole 50 charts, 40 to 50 charts. Okay. Next we will learn components of OP report. Here I will teach you how to choose admitting diagnosis, how to choose like post-op diagnosis or PDX, and how to check the medical necessity, how to code or how to choose secondary diagnosis. Okay. And I will teach you how to find keywords. So just now we have learned laparoscopic keywords, correct? Like that, I will teach all keywords related to open procedure, percutaneous procedure, arthroscopic procedure, and endoscopic procedures. If you understand those keywords, no chart is difficult. Those are super easy. Okay. Next, I will teach you what are the steps to find correct CPT code. Okay. So next, when do we need pathology report? What is the medical necessity of pathology report? Whether do we code without pathology report or not? Okay. Basically, where to start the live chart coding? Whenever you have the chart, where to start? That I will teach you. And also how to use AI in live coding. So nowadays it is very simple to code live charts. So how to use artificial intelligence in live coding. So I will teach that also. Okay. And as I told you, we have nearly 40 to 50 charts, including 1 to 6 series. Okay. Along with that, you will learn 1000 to 1500 common interview questions. These are exclusively for interviews which I have procured from my old students. Okay. So if you learn those interview questions, surely you will get the job along with this training. Okay. So like that. So my demo is over here. So any doubts, guys? Example, this is the chart. Okay. In live coding, I will ask you to code this chart. First, we will learn the basics and I will ask you to code these charts. So I will give you 5 to 10 minutes. Okay. If you are able to code this chart, it's fine. Very good. If you are unable to code this chart, I will explain how to code. Okay. So that is the thing. Before assigning ICD 10 CM, CP 10, ECPIX level 2 codes. So our training, we will learn all this. So it is having nearly 15 pages. Okay. So using this one, I will explain each and every step. So how to choose admitting diagnosis, how to choose like primary diagnosis, how to choose secondary diagnosis, how to choose secondary procedure. All those things I will explain using this chart. Okay. It is having 15 pages. You don't need to worry. Everything step by step. Thank you guys. So if you want to join in our WhatsApp group for free AAPCU webinar links, medical coding jobs in USA, UAE and India, please join in WhatsApp group. Group link is the description of this video. And also if you like this session, please click on like button and comment and share this video to your friends.